Hi, I'm Dr. David Goldbloom. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet, so make sure to subscribe to our channel and turn on the notification bell to stay informed. Today we're going to talk about attention deficit hyperactivity disorder, or ADHD. ADHD is an ongoing pattern of inattention and/or hyperactivity that interferes with people's functioning or development. It affects approximately 5 to 9% of children and 3 to 5% of adults. It is one of the most common disorders among young people and is 3 to 4 times more common in boys than girls, though girls are likely under-recognized and underdiagnosed. Most young people show some of the symptoms of ADHD at different times, including being inattentive, distractible, impulsive, or highly active. As a result, people describe themselves or others as ADHD in casual comments that are not the same as a formal diagnosis. A diagnosis of ADHD may result when those symptoms occur more frequently and are more severe than is considered average among young people of the same age or same developmental level. If these behaviors persist over time and negatively affect the person's family, school, or social life, treatment may be recommended. The symptoms of ADHD fall into 3 main groups of behaviors: inattentiveness, hyperactivity, and impulsivity. Young people may be diagnosed with ADHD if, for the past 6 months or more, they've displayed a range of symptoms across inattentive behaviors and/or hyperactive and impulsive behaviors, including they don't pay attention to details or make what appears to be careless mistakes in schoolwork or other activities. They have trouble staying focused on work or activities. They often don't seem to be listening when you speak to them. Every patient I've seen with ADHD admitted they knew how to fake paying attention in conversation. They often don't follow through on multi-step instructions or have a hard time completing things. They have difficulty staying organized and can be messy. They procrastinate about tasks that will require lots of mental effort or avoid them completely. They often lose things needed for day-to-day life, like their keys, phone, or wallet. They're easily distracted by stuff going on around them, or even by their own unrelated thoughts. They're forgetful for things like attending appointments and paying bills, fidgeting and squirming in their chair regularly, often drumming with their fingers or jiggling a leg in a way that others notice. Having trouble sitting still in a classroom, meeting, or social gathering, and having to get up and move around. Talking too much. Having difficulty playing or working quietly. Running around and climbing on stuff when it's not appropriate. Or feeling restless or always on the go. Difficulty waiting for their turn. Blurting out answers before the other person has even finished the question. Interrupting or intruding on conversations or games that other people are taking part in. Again, most young people display some of these individual behaviors at different times. We all do, to a certain extent. It only becomes a problem when those behaviors are persistent and have a negative impact on the ability of people to meet their potential and to function well in work, school, and other settings. While there's no consensus about precisely what causes ADHD, there is a strong genetic component. Children born into families where there's a history of ADHD are more likely to be diagnosed with ADHD than children where there is no family history. While there have been attempts to link environmental or non-genetic factors such as parenting style or exposure to toxins as causes of ADHD, there is no clear causal relationship. The causes of ADHD are complex and tied to many factors. There are scientific rating scales for ADHD that can help to support a diagnosis and which can be completed by people who may have ADHD as well as by family members and teachers who know the person well. A number of treatment interventions are effective in helping young people with ADHD. The important thing to know about ADHD is that it is fairly easy to treat. While treatment for ADHD should never be just medication, ADHD medication has been proven to be safe and effective over many decades. ADHD medication does not cure ADHD, but decreases many of the ADHD symptoms and improves how people function. Cognitive behavioral therapy, CBT, is a non-medication treatment for ADHD that can help to build self-esteem, reduce negative thoughts, and improve problem-solving skills. CBT can also help people learn self-control and improve their social skills. Other healthy habits that can improve brain functioning for those with ADHD include regular exercise and good sleep habits. If you work or volunteer with young people who have or who you think might have ADHD, these tips might be helpful. Provide the person with as structured an environment and as predictable a routine as possible. Clearly let the person know of any changes in routine in advance. Provide a calm, quiet atmosphere without too many visual distractions. Begin conversations by addressing the person directly using eye contact and wait until he or she is paying attention before speaking. Give instructions one step at a time rather than describing multiple steps at once. Have the person repeat the instructions back to you. Find out what the person is good at and incorporate this into activities. As any parent knows, most young people display some of the most common symptoms of ADHD, inattentiveness, hyperactivity, and impulsivity, at different times in their childhood. Those symptoms alone do not mean that a child has ADHD. It only becomes a condition that requires a diagnosis and treatment when those symptoms are frequent and severe to the point where they are having a negative impact on that person's quality of life. The good news is that with the right supports, a person living with ADHD can have a productive and successful life. I'm Dr. David Goldbloom. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.